Hi everyone, welcome back to my channel CodeMate Mastery. In today's video, let us solve some CPT Anesthesia practice questions. Let's start with the first question. Before that, don't forget to hit the like button, share this video and subscribe to my channel. This is the first question. A CRNA provides anesthesia services without physician direction. So, what is the appropriate modifier? Option A, QX, option B, QI, option C, QZ and option D, AA. Option A, QX is for anesthesiologist is medically directing CRNA. Option B, QY is for anesthesiologist directing CRNA in only one patient case. Option C, QZ is for anesthesia by CRNA. And option D, AA is for anesthesia services performed personally by anesthesiologist. In the question, they have given CRNA provides anesthesia without physician direction. So, the appropriate modifier will be QZ. QZ is a HCPCS modifier that is added to the claim to identify that CRNA provided services without medical direction of a physician anesthesiologist. Okay, next question. Anesthesia time begins when? Option A, surgery starts. Option B, patient enters. Option C, anesthesiologist starts patient preparation. Option D, induction begins. The right answer is option C, anesthesiologist starts patient preparation. You can find this guideline in your CPT manual, anesthesia chapter. According to CPT guidelines, anesthesia time begins when the provider or anesthesiologist begins to prepare the patient for anesthesia services. Next question. Base units for anesthesia codes reflect option A, time required, option B, procedure complexity, option C, patient condition and option D, equipment needed. The right answer is option B. Base units for anesthesia codes reflect procedure complexity. Make a note of it. Next question. Anesthesia for brain surgery in a 6-month-old infant requires which qualifying circumstances? Option A, 99100 only. Option B, 99116 only. Option C, 99100 and 99116. Option D and C qualifying. 99100 is for anesthesia for patient of extreme age younger than 1 year and older than 70. Option B, 99116 is for anesthesia complicated by utilization of total body hypothermia. In the question, they have not given this, so directly eliminate option B. Coming to option C, in option C also they have given 99116, so eliminate that. Option D, NC qualifying means no qualifying circumstances. In the question, the patient is 6-month-old, which means it is a qualifying circumstance. So, option D will be wrong. The right answer is option A. Because the infant is under 1 year old and it qualifies for 99100. And they have not mentioned hypothermia or emergency. Therefore, we cannot code 99116. I hope you're clear with it. Next question. An anesthesiologist provides standby services during high-risk delivery for 45 minutes. The appropriate code is. Let us check the codes. Option A, 99360 is for standby service requiring prolonged attendance each 30 minutes. For example, operative standby, standby by frozen section, for cesarean or high-risk delivery, for monitoring EEG. Option B, 01967 is for neuraxial labor analgesia or anesthesia planned for vaginal delivery. And option C, 01968 is an add-on code for anesthesia for cesarean delivery following neuraxial labor analgesia or anesthesia. And option D, 99135 is for anesthesia complicated by controlled hypotension. In the question, they have mentioned anesthesiologist is providing standby services. Therefore, the anesthesiologist is not administering anesthesia in this case. Therefore, we have to use the code 99360, which is for standby service. and the duration is 45 minutes. Therefore, we have to use 99360 only once because only full 30-minute increments count. So that's it for today. Thanks for watching. If you want to study anesthesia guidelines and practice solving some more questions, you can check the playlist CPC Exam Anesthesia series in my channel.